would like to invite Dr. Smriti Sparsh here with us to share her thoughts on female infertility with us.
Very good afternoon to everybody. I'm Dr. Smriti Sparsh from Patna. I would like to thank Times Cyber for having me here, and of course the jury for having me selected. And since somebody very esteemed before me has already said that this is lunch hour and I shouldn't talk much, with also my son running impatient, this is not actually the apt time. But few things that I would want to mention is that when we talk about preventive, what is more important now is recognizing it way before a disease has actually occurred. So how it used to happen before is when somebody is actually diseased is when they come up to us in a hospital for a cure. So how can we be more entertaining and more creative that somebody would actually hear? But right now, maybe that everybody is not hearing what I'm saying. Likewise, a patient will never hear when you tell them to take preventive health. So how to be very convincing? For that, if any one of us is into infertility, is what I would request, that we should work in a team. As in, if I'm working in Bihar, somebody who is into infertility or if is into any kind associated with preventive, we should work globally as a team. If anyone is also interested now, we can have a small conversation later. But if from different zones, if we work together, we have to increase our reach out to the rural sectors, and for that we actually have to work on a bigger level, as in bring up our ideas. We have to make a plan, and with that plan, how I'm working right now is I'm organizing health camps, which is freely done for the poor people. I visit the rural health camps, I mobilize the ASHA workers, and then of course I talk to the district heads and then get a camp organized. You can't organize a camp in a hospital, you have to organize it in that Sadar hospital, which is the government hospital provided to us. So with that, I have been trying to motivate people by showing them some, we call it Nukkad Natak, if you can relate to the term. We show them those documentary movies which have been made, and by showing them those movies, we give them handouts, we give free health checkups. This is infertility is what we are talking about, since I suppose all of us have children, so maybe it's not a big issue for us. But what we need to emphasize is that people who do not have children, if we could make them understand that it is in the adolescence, if we have begun the preventive health care, which can be very beneficial later on for the people. So my main focus nowadays is on preventive of infertility, so I'm concentrating more on the adolescent. And since I'm a gynecologist, an adolescent can be too old, too young for a gynecologist, and for a pediatrician, the adolescent becomes too old. So because I'm just a beginner in the field, I have 5 years of experience so far, and I can of course cater to them and they can relate to me. So maybe by taking care of the diseases in the adolescent age group is when prevention can occur. And I'm looking at health camps, and I have also been looking at the government funds for preventive health care. So thank you for a patient hearing, but I would also want your support. If anybody is there who can share some ideas so that I can help somebody back there in Bihar in preventive infertility for the adolescents, please do let me know. Thank you for a patient hearing.
In the category of Among Best IVF Clinic in Patna, Bihar, the award goes to MatriKaale Maternity and IVF Clinic. And please welcome Dr. Smriti Sparsh, infertility consultant.